Hello, today my topic is drugs that affect bone mineral homeostasis. So major element are calcium and phosphorus. There are two types of calcium and phosphorus are two major element of bone which play a crucial role but not only for mechanical strength of skeleton but for normal function of many other cells in body. Accordingly, a complex regulatory mechanism has evolved to tightly regulate calcium and phosphate homeostasis, parathyroid hormone, vitamin D, fibroblast, which is a growth factor, primarily regulate, but calcitonin and glucocorticoids and estrogen play secondary role. These hormones or drugs that mimic or suppress their action are used in treatment of bone mineral disorder like osteoporosis, rickets, osteomalacia, Paget's disease, or as several and non-hormonal agents. So, regulators of bone mineral homeostasis. They are divided into two groups. The first is hormonal and second is non-hormonal. Hormonal first is PTH. PTH is parathyroid hormone. Second is vitamin D. Third is calcitonin. Fourth is estrogen, and fifth is glucocorticoids. And non-hormonal consist of bisphosphates, bisphosphonates, fluoroids, and calcimimetics. In hyperparathyroidism, it is a condition of parathyroid hormone that has excess characterized by hypercalcemia. They have bone pain, conjunctive abnormalities, and renal stone, primarily disease, parathyroid dysfunction, and second chronic kidney disease. The next is osteoblast. Osteoblast is bone cells that promotes bone formation. The osteoclasts include bone cell that promote bone resorption and osteomalacia. It is a condition of abnormal mineralization of adult bone secondary to nutritional deficiency of vitamin D or inherited defects in the formation or action of active vitamin D metabolites. Osteoporosis, that is important. Osteoporosis is abnormal loss of bone with increased risk of fracture, spinal deformities, and lost stature. Remaining bone is histologically normal. Paget's disease. This is a bone disorder of unknown origin characterized by excessive bone destruction and disorganized repair. Complications include skeletal deformity, musculoskeletal pain, kidney stones, organ dysfunction secondary to pressure from body overgrowth. Next is rickets. These are diseases that produced in bone. Rickets are the same as osteomalacia but occurs in gross skeleton. Rank ligand. This is osteo an osteoblast derived growth factor that stimulate osteoclast activity and osteoclast precursor differentiation. Now, uh, the bone is a mineralized connective tissue that exhibits four type of cell: osteoblast, bone, link cell, and osteocytes, osteoclast. Bone exerts important function in body such locomotion, sports, protecting of soft tissues, calcium and phosphate storage, and harboring of bone marrow. Bone are made of protein collagen which forms soft framework. The mineral calcium phosphate hardness framework giving strength more than 90% of body calcium held in bone and teeth. The side picture is of bone that is showing spongy bone. These are tiny like structures and epiphyseal line, red bone marrow, and their areas are epiphysis, metaphysis, diaphysis, metaphysis, and epiphysis that are dividing into that regions. Now, The osteoporosis is a health condition that causes weakness of bones, making them fragile and more likely to break, develop slowly over several years, and often diagnosed when fall or sudden impact cause bone to fracture. The most common injuries in people with osteoporosis are bone wrist, broken hip, broken spinal bone, and vertebra. Breakage of bone. However, break can also happen to other bone like such as arm or pelvis. Sometimes a cough or sneeze can cause broken rib or parietal collapse of one bone of spine. Osteoporosis not only painful until a bone is broken, but broken bone is spine are common cause of long term pain. But broken bone is first sign of osteoporosis. Some older people develop characteristic bent forward posture. They happens when bone in spine is broken. Their causings are losing bone is normal part of aging, but some people lose much faster than normal. This can lead to osteoporosis and increased risk of broken bone unknown. Sorry. Women also lose bone rapidly in first few years after menopause. That is the main cause. Women are more at risk of osteoporosis than in men, younger women and children. Now, their factors are many other factors include increased risk of developing osteoporosis like taking high dose of steroids tablets for more than 3 months that are more dangerous for osteoporosis. Other medical conditions like inflammatory conditions, hormone related condition or malabsorption problem. A family history of osteoporosis, particularly hip fracture in present, long term use of certain medicine. Their estrogen level include that affect bone strength or hormone. Their level having eating disorder, anorexia, having low body mass index, BMI, no exercising and drinking and smoking. Now their disorders. Many disorders have associated with osteoporosis for some underlying mechanism. But influencing some bone metabolism is straightforward, whereas other causes are unknown. Now diseases. Hypogonadal state can cause secondary osteoporosis in women, estrogen deficiency in men they cause testosterone deficiency. Endocrine disorder include bone losing, Cushing's syndrome, hyperthyroidism, diabetes mellitus type 1 and 2, malnutrition, parental nutrition and malabsorption. People with rheumatologic disorders such as rheumatoid arthritis, ankylosing spondylitis, systematic lupus, and erythematosus and palliareticular juvenile idiopathic arthritis. But they have also chronic kidney disease, lead osteostrophy, hematologic disorder, several inherited disorder, people with scoliosis. In osteoporosis, they occur when bone less lose minerals such as calcium more quickly than body can replace them, leading into loss of bone thickness, bone mass, or density. As a result, bone become thinner and less dense, so that even a minor bump or accident can cause serious fracture. These are known as fragility or minimal. Trauma fractures, two-third fracture of spine are not identified or test treated even by nearly all use causes pain and some disability. Their diagnosed include osteoporosis can be easily diagnosed on special type of X-ray known as DEXA scan. This machine determine bone mineral density, that is BMD. The bone densitometry DEXA use small dose of radiation of produce pictures of inside of body, measures bone mineral density or bone mass. Their normal bone develop into osteopenia, and then sometimes they include to osteoporosis that is more painful. Now classes. There classes of drug affecting osteoporosis are hormonal and non-hormonal. Like parathyroid hormone, their prescription include or tablets teriparatide forteo or abaloparatide time loss. Calcitonin include meacycline, calcium and vitamin D, cortical supplement. Non-hormonal include bisphosphonates like caldironate, aldironate, binosort, and Fosamax. These are the capsules. And abinodronate, bonvia, and zoldronic acid, reclast, and zometa. Now, monoclonal antibody medications include denosumab, Prolia, Exivia, and Romosub Evenity. Hormone-related therapy include Evista like Relo, Exifene, estrogen replacement therapy. Their testosterone include testosterone replacement therapy, testosterone for male and estrogen replacement therapy for female. Bisphosphonates non-hormonal. Their first generation is medronate, colodronate, eteriodonate, and telodronate. That short term is MCET to remind. Their second generation are amino bisphosphonates, lenodronate, and pamidronate that contain a nitrogen group inside chain, 10 to 100 times more potent than first generation compounds. Now third generation. Their third generation are residuronate and zoldronate contain a nitrogen atom within heterocyclic ring up to 10,000 times more potent than first generation. That is the ring that showing for second generation. Estrogen replacement therapy in women. Evista mechanism of action of raloxifene occur through bind to estrogen receptor. This bind result in activation estronergic pathway and blockade in tissue that express estrogen receptor. Relaxofene hydrochloride 60 mg is dosed orally for osteoporosis. Most common documented adverse effect of relaxofene are hot flashes. Their side effect flu-like symptoms, muscle spasm, arthralgia. Less common effect are ischemia, vomiting, sinusitis, and deep venous thrombosis. Rank ligand inhibitors. These are reactive activator for nuclear factor. Prolia. Prolia is a anti-receptive rank ligand inhibitor and mechanism. Their mechanism of action is essential mediator of osteoclast activity. Increased rank ligand many led to may lead to increased bone loss. They bind rank ligand inhibits osteoclast formation, survival osteoporosis for high risk fractures. Their treatment include increased mass in men for bone with osteoporosis. Their glucocorticoids include osteoporosis, bone loss in men receiving androgen depression therapy for prostate cancer. But in bone they causes adjuvant aromatase inhibitor therapy for breast cancer in women. Testosterone replacement therapy in men. In some studies, osteoporotic men undergoing TRT has been shown to increased bone density through BMD dose not reach normal adult male level. Mechanism of action. The testosterone and its dihydrotestosterone exerts biological effect directly by binding to androgen receptor and indirectly through aromatization of testosterone to estradiol, which allow action via binding. Their side effects are irritation, redness, pain, tenderness, swelling, longing or blistering, stinging or swelling of lips, unpleasant or bitter taste to eat, headache, acne, breast pain, and enlargement. In Forteo. Now, prescription include Forteo for osteoporosis, medicine used to treat postmenopause women who have osteoporosis with high risk of fracture bone cannot use other treatment. Each cartridge per assembled is delivery device into 20 mcg of teriparatide per dose each day up to 28 days. Teriparatide they include manufactured using a strain or Escherichia coli modified by recombinant DNA technology that is a potent anabolic agent used in treatment of osteoporosis. Side effect includes nausea, joint aches and pain. Abaloparatide they are time loss and 80 mg to 40 mcl pre-filled pen delivers 30-day daily dose of 80 mg. Miacycline and calcitonin salmon nasal solution. Calcitonin nasal spray used with calcium and vitamin D to treat bone loss in women with post-menopausal osteoporosis who have been post-menopause. Prolia that is used as 60 mg injection for subcutaneous use only. Next is Evista for osteoporosis. Main formula is Relo, Exifene hydrochloride 60 mg and Forteo 20 microgram 80 microliters solution for injection in pre-filled pen. The miacycline calcitonin samlon nasal solution for 5 year to 200 international units or one spray into one nostril per day. Their calcitonin is a hormone that produced in human by parafollicular cells of thyroid gland. Calcitonin include in helping to regulate level of calcium and phosphate in blood. Opposing action of parathyroid hormone causes reduces calcium level in blood. Calcium D3 nicomate. Calcium D3 nicomate 40 regulates calcium and phosphorus metabolism in body, bone, teeth, nails, hair, muscle, decreases resorption and increases bone density, filling lack of calcium and vitamin D3 in body. Of mineralization of teeth, one pill 2 times a day for treatment of osteoporosis. And calcium include in nerve conduction in muscle, which causes contraction or compact of blood coagulation. By vitamin D increases calcium absorption in the intestine, where they uses increases production of parathyroid stimulation bone